Hi, and welcome. This video is a brief introduction to using the Behavioral Health Administration Community Assessment Toolkit. The toolkit was created by the Behavioral Health Administration in partnership with the Colorado Health Institute and aims to provide local leaders with information and approaches that can deepen their understanding of community strengths, needs, and gaps, and strengthen their investments in meaningful and equitable behavioral health solutions. We're starting on the main page of the toolkit, where you can see how to navigate to all sections. The toolkit is divided into two modules: measuring access, which focuses on how to identify the needs of your community, and making investments, which provides some ideas and guidance for programs that can help address those needs. Under the measuring access module, there are three sections: data, which will link you to resources where you can pull data about the people in your community and across Colorado; community engagement, where you can find some guidance on getting additional information from your community members; and equity considerations, where you can find guidance on equitable ways to collect and describe data. Under the Making Investments module, there are also three sections: continuum, which has a graphic of a continuum of care; examples, which provides examples of programs that can support community behavioral health needs across the continuum of care; and equity considerations, which again offers guidance on equitable approaches, this time to designing and implementing programs and interventions. So let's go to each of these pages individually. First, the data page. Here, we begin with some overall guidance on how to use existing data to identify where there are needs in your community. We suggest you read this as you get started, especially if you're new to needs assessments. One important part of this guidance is that you don't always have to reinvent the wheel. There might already be needs assessments that have been done in your community, which you can leverage as part of your work. In this blue section here, you'll see programs listed that commonly require needs assessments. If your community has already engaged in one of these, for example, Communities That Care or Drug-Free Communities, you might want to check with colleagues or sister organizations as you get started to see if behavioral health needs assessments have already been done for your community and can be leveraged as part of a grant application or program design. After this, we list a number of data sources where you can pull information directly to learn more about needs in your community. Each source includes a brief description of information you'd find there. If you click on the sources, you'll be taken to a page where you can learn more and pull data directly. For example, if you go to the CDPHE Community Level Estimates page, you'll be able to see the information they have available and download the data for your own analysis. At the bottom of every section of the toolkit, you'll see the option to navigate back to the main toolkit page. So let's return there now. The next section is called Community Engagement. It offers resources for engaging your community and collecting more information than what you might have been able to see in the data sources we just saw. For example, you may want to conduct key informant interviews or conduct focus groups. Each of these links to a resource where you can learn more about how to construct these community engagement activities. The final page of the Measuring Access module poses equity considerations for how to best collect and share information. For example, as you reflect on the imagery you're using to describe data, you might want to check some assumptions. Are all the nurses you're portraying young women? Are the CEOs all white men? Again, these all are linked to resources where you can learn more about that topic. We'll now go to the Making Investments module. Again, there are three sections here. The first offers an overview of a continuum of behavioral health care. This is intended to show the breadth of services that fall under behavioral health. Behavioral health supports can be focused on prevention or health promotion, or can include acute care and recovery. Services can also be provided across the lifespan, from prenatal care to the end of life. Returning again to the main toolkit page, in the examples section, you'll be able to investigate existing programs that could help inform the program you're designing. These are truly meant to be examples, and their inclusion in this toolkit should not be taken as favoritism or endorsement by the Behavioral Health Administration. The examples are divided into 6 buckets: whole person health, housing, treatment, harm reduction, recovery, and crisis services. Click on any one of these for more examples. Let's try recovery here. Each section will begin with a definition of this service category. Here are descriptions of recovery-oriented systems of care and recovery community organizations. Then below, you'll see names and descriptions of example programs. Those marked with an asterisk are especially relevant to children, youth, and families. You can click on these program names to be taken to websites where you can learn more. The last section of the Making Investments module offers some guidance on developing and implementing programs in equitable ways. You may want to check considerations around telehealth, transportation, housing, cultural responsiveness, and more as you design and implement a program. Back to the main page. The toolkit also has an FAQ section where you can learn more. If you don't see a question included here, or you would like to see something about the toolkit changed, please reach out to the BHA. I hope this has been a helpful introduction to the Community Assessment Toolkit. Thank you so much for your time.